my name is Dr. Morgan Duval. I'm a physical therapist and I'm here to take you through a few exercises for the foot and ankle. Now today we're actually going to go through some exercises that strengthen the hip, which might be a little bit counterintuitive, but hip strength and stability is extremely important for foot and ankle function. And I'll tell you what I mean. If you have weak hip abductors, that's your gluteus medius muscle here on the outside of your hip, what can happen when you're walking is your hip actually kind of pops out to the side a little bit because you don't have that stable muscle. Your knee rotates inwards and causes your foot to rotate inwards as well. So it can lead to what we call pronation of the foot with walking, running, hiking, all of those things. So the exercises we're going to go through today are actually designed to strengthen your glute for proper strength and stability down the chain all the way to your foot and ankle. Now the first exercise we'll do is on the ground. You'll lie down on your side, just like this. This is called a clamshell. All right, so you can be propped up on your forearm like I am, or you can lie all the way down, whatever's comfortable for you. You'll stack one hip on top of the other. Knees should be touching, ankles should be touching. From here, you'll just gently open up your knees and then place them back together. Do not let your hips roll backwards at all. So hips are super strong and stable here, up and down. Now you might notice that I have some bands right here in front of me. You can always loop bands around your leg to make this more challenging. However, I do think that you're going to find the next few variations on clamshell challenging enough. After you start to feel a burn here on the outside of your hip, you'll switch to the next exercise, which is called a reverse clamshell. Keep your knees touching and open up your feet. So you're internally rotating your hip here, and you should feel a bit of a burn right in that gluteus medius muscle. All right. Next exercise, after you've completed a good amount of these, you'll separate your knees and also your ankles. This is your starting position. Then again, you'll internally rotate your hip to tap your knees together, returning to the starting position every time. Now your gluteus medius is a muscle that actually does internally rotate your hip. So this internal rotation clam is extremely impactful for strengthening that muscle that it abducts your hip, abducts your hip, and also creates so much strength and stability down the chain. I'm starting to feel a burn, so I'm going to move on to the next variation of clamshell. You'll bring your knee backwards, so it's actually in the same plane as your hip, and then internally rotate, just like you were doing, but now you're tucking your knee behind your other knee, all right? So you're still getting that internal rotation moment. It should be a little bit more challenging because you were also extending at your hip. Okay, and again, you can always add a band around your legs to make this more challenging if you wish. That is exercise number one. Once you've completed that exercise, you can scoot back so that you're about 1.5 to 2 feet away from a wall behind you. You'll straighten your top leg and connect your heel with the wall. You're actually going to actively push into the wall here. You should feel your glutes engaging. Make sure that your toes are pointing forwards, maybe a little bit downwards to keep your hip internally rotated. Remember that gluteus medius, that really important muscle, it's an internal rotator of the hip, so it's important to keep your toes facing downwards, not upwards. Okay? Once you have that position, you'll gently slide your heel up and down on the wall. If you actively push your heel back into the wall as well, you'll be firing not only the glute med, which is lifting your leg up and down, but also your glute max, which is pushing your leg backwards. Okay, so once you feel a pretty good burn through your glutes in this exercise, we'll move on to the next exercise, which is standing. Okay, so next exercise, I'm going to stand up, and for this one, I will be using my yellow TheraBand. I'm just going to loop it around my ankles here. So you may notice that I am working my left side right now. This next exercise is slightly counterintuitive because the moving leg is not the leg that does most of the work. What I want you to do is stand up nice and tall, squeeze your glutes, squeeze your core. You'll shift all of your weight over to the leg that is working. You'll take your right leg forwards, back to center, then to the side, back to center, then to the back to center. Take a rest. You should really feel your left glute firing here. I recommend doing this exercise in front of a mirror because in front of a mirror, you can watch to make sure that your knee does not rotate in while in the exercise, right? Make sure that you keep your knee stacked directly on top of your foot, your glute engaged, standing up nice and tall, forward, side, back. doing this exercise without shoes on so that your feet can properly grip and interface with the floor. All right, final exercise that we're going to do in this video, we will keep the band around your ankles. Again, you'll stand up nice and tall on your left foot, squeeze your glutes, make sure you're not letting that knee rotate in at all. You want to keep it stacked directly on top of your ankle, and that should happen when you squeeze your glutes. You'll lift your opposite foot up. For me, it's my right foot, so it's hovering about 1 inch above the ground. Now, you'll squeeze your glutes even more to rotate that right foot out, and then slowly bring it back. I don't want you to twist from your hips, so pan up to my hips here. This is what I do not want. Okay? The left hip bone should remain pointing directly forwards. The right hip bone should open. Okay, so it's an opening only of the leg that is moving. The stable leg for me, which is my left leg, is not doing anything at all, but my glutes are firing quite a bit here. I'm squeezing a lot, and I'm really starting to feel the burn. Okay. So those are my favorite few exercises to target the glute med, which again, fantastic stability for the glute, improves your mechanics all the way down the chain. A lot of times if you're having medial knee pain or maybe foot and ankle pain along the top of your foot or even on the inside, a lot of times it's not even there's something wrong with the foot or the knee, right? It can totally be coming from weakness all the way up the chain to the hip. So very, very important to incorporate these exercises into any foot and ankle rehab program. All right, thank you so much for watching, guys.